want to make sure you're left with a message of hope. And I've had several people say to me, it's really nice to see this data because I feel some of these things, or I'm experiencing some of these things. And it's nice to know I'm not alone. So in the chat, or, when I'm done, we'll have an opportunity, well, throughout actually, for you to ask any questions you might have. You can raise your hand or go off mute or put a question there in the chat as I work through these slides. The first thing that we want to share with you is that there are some populations that have an increased risk of severe illness and death from COVID-19, as well as increased transmissions. And again, this is state level data. So people that are experiencing marginalization, systemic inequity, and health inequities, such as racial and ethnic groups like African American, Latinx, Native American, Pacific Islander, immigrants or undocumented people, and folks that have limited English proficiency, people with disabilities, and people that are currently experiencing homelessness are all groups that have an increased risk for severe illness and death to COVID-19 or from COVID-19. As far as increased transmissions, some of these probably won't surprise you. People that live in high density situations, and examples of that are what we call congregate care settings, like long-term care facilities, or congregate living settings like shelters or correctional facilities, people that are living in homelessness or unstable housing, low-income housing, and then multi-generational households where isolation is difficult. Additionally, people that have high-risk economic or work conditions, like those of us who are deemed essential workers that have extensive contact with the public. You might think of grocery stores, people that don't have paid sick leave or health insurance or adequate health insurance, and then people that have to go out into public for frequent resources. So those are some of the populations. When we think of an equity lens around COVID, we're really looking at, which populations are really at an increased risk for some of these things. If there's no questions on that one, we can bump to the next slide, Symetria. So this graph is actually adapted from SAMHSA, which is a Substance Abuse Mental Health Services Administration. It is, as it says, reactions in behavioral health, symptoms and disasters. So it's a graph that existed pre-COVID. And it's familiar to folks like emergency responders that respond to disasters throughout the nation, floods, hurricanes, that kind of thing. And you'll see in the beginning, there's a pre-disaster, and then that first dip down is the impact. So for COVID, we're thinking of that about 2 weeks from now, a year ago. So around mid-March, our first case was in January. But the stay-at-home order was the middle of March. That's when the schools shut down. So that's really the impact point that we're looking at. And you'll see it goes way up from there into this honeymoon phase, and it has the word heroic there. And that's really when, so many of us were like, how can I help? We were asked if we could be called into the response in some way or another. Community-based organizations and, churches, whomever was trying to help in any way that they could. People volunteered to make masks by the hundreds, once we knew that masking needed to be a thing. And then you have a slow or really not gradual, a very steep dip down after that honeymoon phase. And, this is kind of like through the summertime when we were like, when is this going to end? What's happening here? And then we have this low point here. There's a circle there that says Washington as of 1/28/21. And that's just about a month ago. We're in this phase of disillusionment, which really started, I would say, in the fall, late summer of last year. People just experiencing this disaster for so long. And there's a couple different ways we deal with that. Some people really internalized it, decided not to leave their homes unless they absolutely had to, wearing masks everywhere they go, really being cautious who they spend their time with, how much they socialize, to the extreme opposite end of, I don't need to wear a mask. I'm going to do what I'm going to do anyway. The government's not going to tell me how to live my life. We're going to get it. We're going to get it. That's just the way it's going to be. So we have everything from those two extremes in between. And when we have a disaster occurring for so long, we see that disillusionment happening because our brains are just trying to grasp the normalcy that we're trying to build around it. And you can see there's a couple different paths from this disillusionment. So you've got that solid, yellow or gold that continues to go up, and we get into, I can't read that word there because my screen is so small. But kind of get back to some kind of a normal, the reconstruction phase, that's what I'm looking for. The dotted lines down here below, they show, this disillusionment could last a little bit longer if there's a secondary impact, if there's other disasters that occur. And an example of a disaster within is that disaster could be the political unrest we saw in our nation last fall. There were definitely, which even carried into early this year. So as those things occur, whether it be at a local level, a national level, or even within your own family, that disillusionment can carry on a little longer. And we're watching that at the state and national levels. And they adapted this graph actually once already in that disillusionment phase. So as I said, all of that really just to show you that if you're feeling some of those extremes I mentioned about, it's totally normal, and you are where you're supposed to be, regardless of which of those extremes you might be in, or if you're somewhere in the middle. You're not alone in that, and it's completely expected to be having those reactions or those behavioral health symptoms. I'm just gonna jump in the chat because I saw a couple questions pop up here. So a general phase are based on Washington data. So the original graph came from SAMHSA, as I mentioned. This adaptation is Washington state specific. And in terms of how the data is acquired, there are 2 or 3 different systems that behavioral health providers report into. And that's reviewed and aggregated, of course, at the state level. Oftentimes at the state level, it takes us a year or 2 to get data. In this case, we're getting it 2 to 3 weeks. So for me, it's super impressive to be looking at data that's so recent, because that's never been the case. That's never been the case for me in the past. But yeah, this is specific to Washington state, and the data that I'm going to share on the next few slides is Washington state data as well. Some of them do indicate where it came from. So if you want to move into the next slide. So this, just to reiterate, behavioral health experiences at this phase of COVID-19 pandemic, or any pandemic, any disaster, they typically include symptoms of depression, anxiety, trouble with cognitive functioning. So you may have friends or coworkers that say, I just feel like my brain's not working right today. It's kind of how we articulate cognitive functioning. Exhaustion, I heard LaKesha say, sometimes taking rest is, I can't remember where the word was, being productive. That was me the last couple of days. I just needed to stop at the end of the day and get some rest. And burnout, whether that be at work or home. So we want to remind you that active resilience development is an essential intervention for all groups. And this came from the behavioral health report. They've identified different groups. But really what we mean by that, resilience is typically defined as the capacity to recover from difficult life events. So having active resilience, like really looking at what are the ways you can take care of yourself. And as Symetria mentioned in the beginning, you may be a behavioral health provider here today. We also encourage you just to really think of your family role, your community role, and then yourself personally. What can you do to have that active resilience? Okay, if you want to move into the next slide, I'll get into some of the data. And as I mentioned, I review, every week I review that situation report. So this data is being pulled from the state's, what they call a SITREP, specifically for behavioral health experiences. And some of the data, like this is the US Census Bureau, but then as I mentioned, there are behavioral health facilities and providers that are reporting into state level data, and that's where some of this comes from. So in the terms of depression and anxiety, which is one of the biggest areas that they follow and have results for, as of January 6th, so we do have a couple weeks later than this, but the data, I reviewed it before today, and it's pretty much the same. There has been an increase in anxiety and recently a decrease in depression. For a long time, we saw a continual increase in anxiety and depression over most of 2020. And now it seems it's splitting a little, and anxiety is increasing, but depression is regulating or decreasing among adults in Washington. And they compare this to the previous reporting period. You can see that's December, most of December. And later on, they compare it to the previous year as well. Depression measures continue to indicate disparities among some of the demographic groups. One that sticks out is that the younger someone is, the greater their frequency of experiencing depression and anxiety symptoms. The frequency of depression symptoms appears to decrease as household income increases, and that's more pronounced for anxiety than it is for depression. One exception is that folks who are in a no income group report rates lower than 20%. So as your income increases, your depression rates decrease, with the exception that if you have no income, there are very low reported rates of depression. Those who identify as 2 or more races are reporting higher rates of depression and anxiety. And then those who identify as female have increased symptoms reporting for both depression and anxiety. So I'll just pause there and check the chat here. Yes, loneliness was already a big problem before the pandemic. So one of the things that I heard a couple of months ago in one of the behavioral health provider calls that they have every other week is that it'll be about 20 months from the start of the pandemic for some of those baseline around depression, anxiety, loneliness, for those to return to normal. So we're about 12 months in now. So we are looking at increased need for behavioral health providers and access to care for probably the rest of this year or well into the fall. And then Mike says, sadly, where I work with the fire department, which I think he said earlier, he was part of the CARES team, if you know what that is, they're seeing more 911 calls concerning mental health and suicide ideation. It is a big challenge we are facing with older adults. Yeah, thank you for sharing that, Mike. It's not a happy thing, but if we know this information, there are things that we can do not only to protect ourselves, but if you have an older adult in your family or in your community, just reaching out to people and checking in on them we often feel alone, and especially I have a grandma that lives by herself, and she's very isolated. So unless we check in on her and make a phone call or drop by, she's all alone. So thinking of that and how can I show up for these people, whether it be professionally or personally. If you want to move into the next slide, Symetria. Symetria says her grandma's in a skilled nursing facility. Dollar store balloon drop-offs. That's fun. I know. I actually, my son is selling campfire candy right now, and we have a friend that always buys mints from him, and she's in a facility that had a COVID outbreak. So I had to take the mints to the door and hand them in a bag through to the provider there. I wasn't able to see her. That was hard. Crime and domestic violence. This one, actually, I'm surprised by this because early on we anticipated that these numbers would go up. And of course, this is just one reporting mechanism. This one is actually a law enforcement tool that they use to look at this. But during the week that ended in January 11, the number of domestic violence offenses being reported was lower than the corresponding week in 2020. And they do say that, I think it's the past 6 months, there have been double-digit decreases in other offenses, other crime-related offenses. So this is a bit of an anomaly. We did anticipate that crime and domestic violence would increase. I know that this is really being followed closely, particularly with youth being out of school. We just wanted to make sure that we were providing resources for parents that might be more stressed with a normal domestic violence that might increase. So this one, we're definitely keeping an eye on that as well. Next slide, please. And then this one's particularly interesting to me because I work in tobacco, vapor, and marijuana prevention. They track the product sales for alcohol and cannabis and then handgun background checks for many reasons. We know sometimes people use coping mechanisms, increased drinking or increased use of cannabis or other drugs when things get stressful. So when we can look at the sales of those and then make a pretty educated guess about increase in use. So over 2020, the monthly cannabis tax collections were consistently higher. And I've seen the graph broken down when we looked at April of 2019 and April of 2020, which April was the first full month of the stay-at-home order in the state. The sales of cannabis doubled in April of 2020 over 2019. And then changes year over year with monthly beer and wine tax collections fluctuated, but they generally increased. So we know that people were turning to alcohol and cannabis, and not to place any judgment there, but we often tend to see people using those sorts of things to just kind of numb the fear, anxiety, the symptoms they might be feeling from the effects of the pandemic. And then as far as handguns go, this is looked at because there can be a connection to suicide with firearms or handgun sales. And overall, the number of federal background checks for handgun sales was higher in 2020 than in 2019. June and July showed the greatest year-over-year monthly increases, and then it kind of fluctuated from there on out. Another interesting one to me is that we're measuring social media, where there are expressions of positive sentiment or loneliness and anxiety. So this kind of goes back to Mike and Angie's comments in the chat. From mid-June until early November 2020, tweets related to COVID-19 that were geotagged to Washington for positive sentiment, loneliness, and anxiety fluctuated. And then beginning in early November, all three of those measures showed greater variation than in the previous months. In particular, positive sentiment and loneliness deviated from the averages that emerged in mid-2020. And then expressions of anxiety and loneliness, they thought might be returning to levels that were seen throughout most of 2020. And they made the connection here that, as I mentioned earlier, like that contentious election time and the subsequent election related events, the fall and winter holiday season, with us being asked not to gather with our families, all of those things definitely came into play. And I've seen in the most recent report in January that, or early February, that it was starting to kind of even out and go back to those mid 2020 things that they were seeing. And then the final slide, this, as I mentioned, this changes every month. We get like the current status. I'm expecting one for January here, or for the end of February here in the first week of March. And then every week or every other week, we have a new situation report. So if you're interested in following this data personally or for your work, you can drop your email in the chat and I will send these links to you. Or I don't know if you can grab them from these slides, but there's COVID specific information on our website, srhd.org. And there are tips there on just some healthy coping strategies for, living in this pandemic, all different kinds of things, testing information, screening information. And then the behavioral health resources and recommendations for healthcare providers is housed at the State Department of Health site. And I'm happy to send you that link as well. And it looks like Symetria is dropping them into the chat, so you can grab them from there. Thank you for that. Does anybody have any questions, comments, concerns about any of that? I know it's very heavy data. And again, we just want to kind of give you the lay of the land so you kind of know where we are at this point. And hopefully if you're feeling some of those things that I mentioned or experiencing some of those, it's helpful for you to know that you're not alone. This is definitely where we think people are. And I appreciate your comments in the chat and the experiences that you are all having.
I'm trying to grab this last link and I can't figure it out. So
okay, I can put it in the chat actually while LaKesha's talking. I'll make sure it's there.
It's good. Okay, grab it. Awesome. Thank you so much. That was really heavy stuff. And so the rest of this session is going to be around some tools for healing that we can use today and for the rest of our lives, I think, honestly. And I hope that you guys will share these practices that LaKesha shares with us with people around you. Thanks.
Awesome. Thank you so much, AJ, for sharing that and really holding space for questions and comments because it, like you said, it's a lot to take in. Oh, AJ, there's a question from Carrie about suicide rates.
Yeah, I see that. I didn't mention suicide specifically. I can do a little research on that website or that for behavior. What am I trying to say? For behavioral health providers on DOH. They just really report on depression and anxiety, but I will look that up while we're talking and drop anything I find in the chat.
Thank you, Carrie, for your question, and thank you, AJ, so much. We're going to spend a little bit of time just thinking through some ways that we might be able to heal through the time that we have left in this pandemic, and we don't know what that means or looks like, but hopefully what we share will give us either some reassurance and some validation, or some things that say, oh, I hadn't thought about that. Also would really encourage for folks to put things in chat, come off of mute, and share what you've been doing, and share thoughts that you have that might be encouraging and nourishing for others with us today, or for us to take to folks that we know and who are important to us in our life. So we're going to start this part of our time together just asking you to really get comfortable. We're going to move into Symetria. I think it's the next slide, but it's really just a heading. It just says getting grounded or centered or something like that. And so I really want to invite you in this space to get as comfortable as you possibly can. Maybe that's adjusting your sitting posture. Perhaps you're in a space where maybe you would like to stand up. Invite you, if you're wanting to close your eyes. And really, right now, take a nice big, fill up your lungs, inhale through your nose, and hold it for a couple of seconds. And a nice, slow exhale through your mouth. Perhaps it's nice to think of a balloon deflating. I'm going to ask you to do that another time. Nice big inhale through your nose. Really fill your lungs. Hold that. Nice slow exhale. And now as you just follow your body's natural breathing rhythm, I want to invite you to really feel what you're feeling in your body in this moment. Think about the emotions that you're feeling and where they might be showing up in your body. And really give yourself permission to be present with what you're feeling. As you're following your body's breathing rhythm, I invite you, maybe you need to drop your shoulders, perhaps roll them. Perhaps you will need to stretch your back. Shake out your legs. Roll your feet at your ankles. Perhaps roll your wrists. Think about your face. What are you holding, if anything? Are your eyebrows tense? Asking you to drop your forehead, relax there. Nice big inhale in. Slow exhale out. As you're taking your big inhales in, I invite you to think about permissions that you'd like to give yourself, for things that you'd like to pull into yourself as you're taking those nice big breaths in. And on your exhales, what might you want to release, at least for this few moments together, perhaps for the rest of the day? On your next big inhale in, I'm going to invite you on that exhale to really make a noise. Perhaps that noise is ah, or perhaps it's but a nice big exhale with a noise and a sound that fully releases. Invite a couple more nice big deep breaths, and we'll come together and explore our next slide in 5, 4, 3, 2, 1. And as we're preparing to think about validation and curiosity as powerful tools, I would like to invite folks to share how they are feeling, if that breathing exercise, if that felt valuable to you, or if that was helpful to you, and invite you to think about spaces and places where that might be helpful for you through your day. How are you feeling? Just to check in on you all. And y'all may have noticed, LaKesha, I hold silence very, very well. Some of it is, I see Curtis, it's good to see you. Some of it, thank you, Mike, a lot better. Some of it is, I do truly believe that when silence is not being weaponized, it is a beautiful gift. Also, thank you, Curtis. Also, I really believe that sometimes we just need quiet. We just need to have some time to process and those things. I am very, very comfortable in silence. So when I give pauses, don't feel like you need to fill the space. If you really don't have anything that you'd like to share out, that's great. But I will hold that space for us and then move forward. Mike, I'm so glad you're feeling a lot better. Validation and curiosity, as tools. So validation, thank you, AJ, for sharing that January update on suicide information. Validation is a hugely important gift that we can give ourselves and others. When we validate something or someone, it's reaffirming, it is affirming, and validation also says, like, I see you, I recognize this, I see myself, this is real, right? So validation is a huge tool that we can use during any time. We can use it for ourselves. We can use it for others. Thank you so much, Angie. I'm so glad that that gave you a chance to pause. Thank you. So validating our emotions and our experiences during this time and really naming them and saying to ourselves or to those that we care about, those around us with whom we're working, our friends, our family, when perhaps it might be anxiety that's coming up or a sense of overwhelm, but being able to say, of course I'm feeling overwhelmed right now. I'm Perhaps I'm a student and I'm working and I'm checking in on elderly family members. So of course I'm feeling overwhelmed, and I'm still living in the midst of a pandemic. Of course I'm feeling overwhelmed. You're here for a visit, and what I'm gonna do is pause. I'm just going to, as I feel you, I'm just gonna pause and think about what I can hear right now, or I'm going to pause and take some deep breaths. But really validate that for yourself, name it. Of course, I'm not feeling positive in this moment. And it's okay for me to not feel positive every single moment of every single day, right? We can hold that. I know at some point on the other end, there's going to be a light at the end of the tunnel. I don't know when that's going to happen. I don't know how long the tunnel is, but I know that there's a light, and that I'll see it, and that I'll heal through this, and that I'll come through this. That's optimism. Positivity is more about that day to day, that second to second, that moment to moment. And it's okay to experience negativity. It's 100% okay. Name it. Of course, I'm feeling a bit negative right now. I'm feeling a bit hopeless right now. And when I feel this way, these are things that I can do. I can call a friend. I can talk to a loved one. I can watch cat videos on YouTube, whatever it is that helps bring you back to that space. I can go into my garden. I can take a walk. But just to name that for yourself and not try to push it away or invalidate it, make it like it's not real, or that, and give yourself grace and space to know that experiencing whatever emotion you're experiencing has nothing to do with your worth, your value, or how quote unquote strong you are as a person. Okay. Curiosity is another tool that we can use. I'm curious about why I'm feeling this way right now. I'm curious. I realize that I'm feeling overwhelmed, and I'm curious where that is coming from. To allow yourself time to pause, stop, think, and reflect. Right? Start to use some of those questions. If some feelings or emotions are coming up, I'm curious when I've felt this emotion before, and start making some correlations between those moments and then how you have perhaps healed through or worked through that emotion before. So curiosity and validation. Thoughts, questions, pushback on either of those two. Awesome. Again, if things do come up as we move through, please feel free to name that and bring that forward at any point in time. We'll move to the next slide. Center your joy and your peace. Guess what, y'all? Even in the midst of this, even though we know that there are hardships that have been intensified, that we've all experienced some things that have not been pleasant during this time, we still get to give ourselves the gift of centering our joy and centering our peace. And that can look and sound and feel like anything. Perhaps your joy is turning on music and having a dance party in whatever room of the house. Maybe it's all throughout your living space, right? Perhaps your joy is a cup of cocoa, yum, with some warm milk. Or perhaps your joy is an experience on FaceTime or Zoom or Teams with someone that you care about. Perhaps you're finding joy in your garden or taking a walk, going on a hike. Perhaps your joy was a piece of chocolate that you had, or a nice hard candy that you like to suck and just really spend time with, right? But center your joy. Give yourself permission to experience and feel your joy. Also your peace. Sometimes you might be in a space and you really would like to maybe engage in that game night with your friends and your family over Zoom, but that won't be really peaceful for you right now. Maybe it's, I really just need to have no sounds around me and I just want to close my eyes and just really experience peace that way. Perhaps the peace is a walk, or perhaps your joy and your peace might be reading a book or doing some writing, but really find ways to center your joy. What's making you smile? What's bringing you some happiness, right? So centering your joy and your peace. Ooh, Mike says sweet Hawaiian food. Nice. Thank you, Mike. What else is bringing you joy? I would love to see in the chat. What's making you smile? What's making you laugh? What's bringing you joy? How are you centering your peace and your joy? And please feel free to come off of mute and share that, or share that in chat. Maybe it's an online Zumba class or a yoga class. Perhaps it's healing circles online. Symetria says organizing things. I can feel that, Symetria. Yoga books and chai tea. I love it, Symetria. Nice.
I'll share.
Yes, Angie, thank you.
So I was furloughed and I've spent a few months at home and just sort of thinking about what's next. And I realized I had this desire to explore writing and doing some things like that, so that I had not had time to do before. So I joined a writing group and it's just been such a positive experience. I even got myself a mug that my favorite chai tea when it's writing time, and it says "Go write now," WRIT.
I love that.
And it just makes me smile every time, right? And then I fill it with my turmeric chai, and it's just a happy moment, right? And so, yeah, so I think after you mentioned, the contentiousness of the fall and, all how kind of toxic social media got for a time. So I've taken about 1 month break, and I've been doing some certifications and some conferences online and things that just fill my well, right? And just because I want to be able to pour back out, but I need to fill it first. And so just to be in those positive spaces where women are lifting one another up and encouraging each other after all that negativity has been exactly what I've needed this last month.
Thank you so much, Angie. And I love the mug. I love that. I see folks are baking. I would love to know what you're baking. Ooh, I'm thinking about peanut butter cookies today and baking. Video games, Candy Crush is happening. Wonderful. Please keep filling the chat with things that are bringing you joy. It might spark someone else's, and that is really beautiful and great. Thank you, Angie, for naming that these are things that are really pouring into you so that you can then share that gift with those around you, because that is so important. It's a really important part of taking care of and nurturing and nourishing ourselves. When we do that, we're able to do that for others. And there are times, and I think there might be a slide down there for this. Hopefully there is, but I'm going to say it. We can move on to the next slide, Symetria. But one of the things that I really invite us to think about is, as we are doing these things that are kind of filling us up and replenishing us, that there might be moments and times where we feel like, oh, I can't today. And that is perhaps when someone in one of the many communities to which we belong, maybe that's a friend community, your community of family, and family defined, however you define family. Perhaps that's a faith-based community, or a community of folks who engage in like hobbies and interests, and perhaps they are able to pour into you. Maybe you received a text or a message, someone checking on you, and that poured into you. So really wanting to invite us to think about not just self-care, but community care, and how connected those are, how as we are filled up, we're able to pour into members of our community, and then they can pour into us simultaneously. And the same is true for our healing. As we are healing, we are making it possible for others. Others are looking at us and saying, oh, wow, look at that, right? And they're able to heal. As we heal individually, our communities heal. And so there's this really great reciprocal piece to self and community care and self and community healing. Carrie, that is so true. It is really true to that sometimes it's difficult to recognize that as a parent. Will be so honest, my daughter is 23, but when she was little, and even sometimes now she's in LA, but even sometimes now I will just go hide in the bathroom. There were times I was not even using the bathroom, but that was my peaceful place. I could just go hide in the bathroom. And sometimes, Carrie, what I would encourage as caregivers and parents is to remember and hold that in those hard moments, we don't want to beat ourselves up. We don't want to blame ourselves or shame ourselves when we're having those hard times with that. Carrie, I'm so glad you could rate. I'm over here cracking up about that. Yes, Mike, having a puppy and a kitten do count. You have to take care of them, right? And I love it, a plant parent. So I love it. As we are thinking about things, and there are many other tools. I think another tool that that is not here is the 5, 4, 3, 2, 1 tool that you can do anywhere. And that can look like, okay, what are 5 things that I can see right now? What are 4 things that I can hear? What are 3 things that I can smell? What are 2 things that I can touch? Right? So, and it doesn't have to be those things in that order. You can start with 3. What are 3 things that I can look around and see right now? What are 2 things that I could touch? And what's 1 thing that I can hear? And just spending time with each of those, being really intentional and stopping and looking. What are those things? Maybe give yourself time to describe them. Those are just a couple of things that I wanted to share, and I'm really looking forward to hearing what you all are doing. And as you're thinking about what you're doing and what you'd like to share or continue sharing in chat, would really invite us to hold that we can heal through this time. I think there's been a lot of get through this time, and we definitely are, but I would encourage us to think about how are we healing through this time, so that when we do come on the other side of this, when we are ready to start making that transition, that we are able to do so in ways that might position us to do it in a healthier, more whole way. Uriah, thank you so much. Oh yes, get your quiet by being in the car. I can relate, Uriah. Thank you. Thank you so much. I would also, I shared with, I believe AJ was on that call, but I shared with AJ, Heleen, and Symetria that one of the other things I'd like us to hold is we've heard quite a bit about we're all in the same boat. We are all in the same boat with this, every one of us. And I saw something and read something that said, let's think about that, right? We're all in the same storm, but we're not necessarily all in the same boat. Some folks, some of the time, some of us might not even be in a boat. We might be hanging on a raft for dear life, right? Somebody else might be in a yacht and they're sailing through this storm with a very different experience. Some of us might be in a kayak or, you know, in a canoe. So we're in the same storm, but we're not necessarily in the same boat. So just want to hold that and offer that up, and to remember and hold that the things that we are experiencing and the things that we're seeing, they're not new. This pandemic has exacerbated them, but they're not new. We're not alone. And to really think about where systems of oppression are asking us to hold shame and blame during this time, and how we might be able to use validation, curiosity, turning to wonder, deep breathing, conversations with friends and family, all of the tools that y'all have named in the chat, and various other tools to hold that I can heal through this, and that I'm okay in those moments, even when I don't feel okay, when I feel broken. Even in my brokenness, I'm whole, right? That it's okay to feel broken sometimes, and that it's 100% okay to experience your joy, to look over this past year that we've been experiencing and say, where have I experienced growth? What are wins that I have experienced? And it's not arrogance. We get to name those wins. We get to name where and how we've grown. And those can be great healing tools, great spaces for us to see how we are healing, how we are how we're healing and making it through. So those are just some things that I'd invite us to hold. Thank you so much, Symetria. Question: sun and no more snow. Y'all must be getting a lot. We had our 2 days and I had about 15 inches in my yard, but no more. So hopefully not. So my question for you before we get ready to move into, and perhaps maybe Symetria, let me know if you'd like to combine them. Folks have been sharing what they do. I'd love to hear more about what you're doing, how you're healing through, what support looks like and feels like for you. And then what resources, what things might you need to see to help support you on your healing journey as we are moving through the pandemic. Folks wanting to get out on their bikes. Nice. So I'd invite you to think about a couple of things right now. I know one of the things that Symetria is really hoping to learn are what are things that, and resources, tools that you might need or desire to help you and those you care about and love heal through and work through this time. And then what are you doing to nurture and nourish and pour in to yourself? Thanks for sharing so many great things in chat. And then Symetria, I am going to stop talking and let you take it away.
Thank you, LaKesha. I have my dryer going in the background. I hope that you can't hear the background noise. But yes, I just want to give you all a little bit of context on who Better Health Together is, and I'm sure you know the position that Spokane Regional Health District serves in the community. But as a program manager at Better Health Together, I would really like to be able to bring some ideas to organizations in the community, providers and community organizations, of gaps in resources. So if you're hearing from your family members or your clients or people in the grocery store about gaps in resources, if you could drop them in the chat. I know you've mentioned some already. Isolation is huge. BHT and the Spokane Regional Health District can bring that back to the task force that I mentioned earlier and really integrate these priorities in our work. So please let me know. I'll put my email in the chat as well if you have anything that comes to you later.
Symetria, something that just occurred to me. I live in 9 Mile, and half of our school district is in the Spokane County and half of our school district is in Stevens County. And I know that sometimes our school people, when they have behavioral issues in school, and of course kids are, you know, disrupted right now. Some of them are just starting to get back into more regular days and regular routine, but many of them are still at home. And I'm hearing from both parents and educators that they just sometimes feel like they don't know where to go to refer families for help if they see behaviors that are starting to be concerning, whether in the classroom or at home. And certainly there's been kind of this disparity of if you live in the next county over, even though you're only 20-minute drive or 30-minute drive from all the Spokane resources, they feel very shut out. Like there isn't kind of a hand across the bridge to say, here, let's connect you with a support group or with parents who've been through this or mental health resources or whatever. So maybe you can address that and direct me a little bit more. Obviously, if we're in southern Stevens County, some of our families, that's a long way to go to Colville, so for services. So just maybe that's been one of the things I've seen consistently, both as a parent and as an educator in recent years.
Awesome, Angie. Thank you so much for sharing that. We know that resources for youth are hard to come by in the first place. And, you know, especially when you get out of Spokane County, but even in Spokane County as well. We do have collaborative meetings that bring partners together in each county in our region, and Stevens is one of those. So I'd be happy to share that with Reese, who's on my team and runs that collaborative in Stevens. Thank you. Mike, I love your coffee and food runs. That really resonates with my family. I feel like coffee is in our bloodstream. Okay, folks. Coffee runs are my coping mechanism. Yes, mine too. All right, I'm going to move us to our last slide. We have about 10 minutes left, and we can probably get you those minutes back in your Saturday to enjoy the sun. These are some additional resources available. The Department of Health put together this Washington Listens line. You can learn more about it at washingtonlistens.org or call the phone number there that they can help you guide you to resources. And then these are the same links that we dropped in the chat earlier from the Regional Health District, some family resources just throughout COVID-19 resources, and then the mental health and coping webpage. Does anybody have any questions for myself or our facilitators before we let you go on with your day? The link in the chat. Let me copy and paste from above.